So mental capacity, inform them of the dangers. Obviously, there's lots of different ways to call med control. Like in my department, I don't have to call med control. Obviously, if it's one of those weird situations like that where I feel like, man, this dude needs to go, and they're adamant about not going, that's when I would be like, okay, now I'm going to call, like, hey, I'm going to let you talk to a physician.
This is the way that I train my medics to do this. And we've talked about this in some of our lectures we've made together.
Yep.
But I use the acronym for a great band, ACDC. The patient is able to make an autonomous decision. I like to use the word autonomous because that's the A for ACDC. Right. The C would be consent. Is there mental capacity and legal capacity? Yep. And then disclosure is the D, ACD, disclosure. Yep. And we have to be really good at pulling up that knowledge we've learned from watching our videos and from learning from your medical director and CEs and educational activities you're training. I know that when I see this injury pattern, it could mean badness. Yeah. And so I'm going to disclose that information to my patient. The last C is the patient has to be able to communicate this back to you. Right? Yep. I mean, document that decision, that communication. Right, exactly. So I think ACDC is a good thing to remember. I actually think about that acronym and I put them into my note and I document all those components. And
it keeps track of the questions you need to ask and the documentation you need to do.